Hello guys, today we will learn about pharmacology, which is first exam for D Pharma. It has it is the topic name is chemotherapeutic agents, which covers 11 marks, 3 marks 2 question, 5 mark 1 question. Let us know the introduction part. Chemotherapy. The chemical substances which are used for the treatment of the diseases caused by the microorganisms, tumor cells are called chemotherapeutic agents. Generally, chemo means cancer. The drugs which are used to the treatment of the diseases caused by the microorganisms and tumor cells, cancer cells, are called chemotherapeutic agents. The chemicals which are used to chemotherapeutic agents are also called as antibiotics and antineoplastic agents. If a patient is chemotherapeutic, then antibiotics and antineoplastic agents are used. Nowadays, it refers to the treatment of cancer usually. It is a medical term. Cancer is a day-to-day common term. The antibiotics are further divided into bactericidal and bacteristatic. Bactericidal means kill. Bactericidal means kills the bacteria. Bacteriostatic means prevents the growth of the bacteria. Here, bacteria growth will be remained less. Bacteristatic, where bactericidal means the whole bacteria will be killed by using medications. Here, the basic principles of chemotherapeutic infections. It has 4 steps. Step 1 is diagnosis. If a disease occurs, first of all we will diagnose it. So like that, chemotherapeutic disease also like that. Before chemotherapy, diagnosis should be performed for determination of type of microorganisms and site of infection. Chemotherapeutic diseases occurs heavily in urinary tract like cervical cancer, fallopian tube cancer, etc. In breast, especially breast cancer, brain tumor, etc. Brain tumor means brain cancer. Next, step 2, selection of a drug. Drugs should be selected according to the type of the pathogen. How the pathogen means how the disease occurs, and should consider which is required, whether narrow spectrum or broad spectrum. Broad spectrum means very high tissues. Whole organ may diseased. Narrow spectrum means located area, like this area, like here, and heart, brain, etc. Step 3, frequency and duration of administration. How much we have to give the drug to the patient. Low dose can develop resistance, means it will cause the resistance, means if the bacteria grow in the body, it will stop the growth of the bacteria, and it will create problem to the growth of the bacteria. Low dose can develop resistance. And intermediate may not cure the disease completely. Sometimes intermediate drugs are given, so these drugs can may give the immediate relief, but it does not cure the disease completely. So optimum dose should be used. Now the fourth step is continue the therapy. If the disease is acute infection, it is treated for 1 to 2 weeks, that is 5 to 10 days. But sometimes it takes long time when the disease is chronic disease. It may takes months, 1 to 6 months. Examples are tuberculosis, thyroid, breast cancer, urinary cancer, etc. Now the final step, prophylactic chemotherapy. In this, chemotherapy is used for the prophylaxis to avoid surgical site of infection. If a physician is making the operation to the patient, if the surgical contamination happens means, so this prophylaxis chemotherapy will act. Prophylaxis means action taken to prevent the onset of the diseases. If the disease occurs means, if another disease occurs in that means, the action taken for that is called prophylaxis. Now the classification of chemotherapeutic agents according to their range of action, how much it will act to our body. In that there are mainly 3 types. First one is broad spectrum antibiotics, narrow spectrum antibiotics, and the final one is the relative broad spectrum antibiotics. In that first one, broad spectrum antibiotics, the agents which are effective against the gram positive and gram negative rickettsia and chlamydia are called broad spectrum antibiotics. The broad spectrum antibiotics will act on gram positive and gram negative tissues in our body, and the example for this broad spectrums are tetracycline, ampicillin. Now the second one is narrow spectrum antibiotics, the drugs which are effective against only gram positive and are called narrow spectrum. In that penicillin are the examples, erythromycin group, vancomycin, etc. In narrow spectrum, the agents which are effective only against gram negative bacteria. In that examples are streptomycin, colistin, polymyxin B, aminoglycoside antibiotics are the examples. Now the last, relative to broad spectrum antibiotics, the agents which are effective against gram positive and gram negative bacteria but having more effect than narrow spectrum antibiotics. In relative broad spectrum, the antibiotics will act on body relatively lower than narrow spectrum and higher than relatively lower than broad spectrum and higher than narrow spectrum. The examples are ampicillin group, cephalosporins, rifamycins, etc. Thank you.